It is our workforce and our future workforce that is at risk. So we talked about how do we get the will to do that? And part of it is to create an environment favorable to significant expansion. One of the questions that we've had is what was the will of this country to pass certain great pieces of legislation, the Civil Rights Act? What made it gave this country the will to do that? Say? That probably TV was probably the catalyst. I mean, some would argue that television, for the first time, it was difficult for those who were opposed to it to be able to relate to family members when things were happening to kids, and they had to watch it on the evening news together. And there's a lot written about the value of TV. And if we watch what happened in South Africa, as long as South Africa had a reasonable control of the media, they had very little exposure around the world until people became focused on that. And I'm not arguing whether we have to have a riot or not, but what I have to say is CHA has tried to begin to have this discussion and encourages everybody to have this discussion. It's not our issue, it's everybody's issue, every religious group, every social group, but it is not the hospital's issue. The hospital's employees have an issue, but the entity itself would be viewed as having too much secondary gain in this to carry this. What happens if all of our facilities have no uncollectibles? That's a real problem. It's a public keeps saying, well, you guys and ladies are making enough money. Hospitals got 3% margins. You're building new marble buildings. You're moving to the suburbs. All you doctors are making $10 million a year. All you nurses are making $100,000 a year. All the administrators are making $30, $40 million a year. Why do we need to do anything else? So given that, it's a different debate now because now it's about the will to change this. So part of our discussion has been around this issue of infrastructure. What do we have to do? You know, the uninsured week has been a big issue for CHA. Some brochures and some information. There are 2 or 3 organizations that have a task force that they funded out of their own healthcare systems to begin this discussion about how do we understand what the will is. We have a strategic plan. I'd encourage you to go look at the website. And then in Health Progress and Catholic Health World, there's some discussion. And also, Catholic Healthcare is here with all the other sponsoring organizations to have this discussion about how do we get the social will to create a different system.